So what's the solution? We can provide an alternative financial environment for healthcare, which will be preferred and chosen over the entitlement programs by our citizens. First, we would require everyone to choose his or her own privilege, either government-sponsored healthcare or self-determined healthcare with limited public financial assistance. Those choosing the former, government-sponsored healthcare, would accept open-ended government support as it is currently offered. They would accept the standards of qualification for beneficiaries set by these programs, such as age, income level, and medical diagnoses. They would continue to allow government to supervise their health care and attempt to control expenses via regulation of providers, influence on personal lifestyle choices, price controls, formulary restrictions, pre-certification of services, etc. And they would accept medical care from the pool of providers limited to those who are willing to work with the government programs. Now, those who choose self-determined health care with limited public financial assistance would accept limits on the public support according to a budget. We could start perhaps with 50% or less of the expenditures which would be anticipated for a similar person or population under the government programs. These people would accept distribution of available public funds chiefly to those with lower income and more complex or expensive medical problems. They would also surrender any claim of a right to health care provided by others, submit to the established criteria of qualification for financial assistance, and not expect or demand any help from government beyond the allowance granted. However, those choosing this option would benefit from restricted government interference. We would allow these individuals and families to set aside non-taxed funds for health care according to their discretion, without limit and with complete ownership of those funds. This money would be maintained in personally held private accounts with private banks, and once funds were deposited into these accounts, they could be used liberally for medical expenses and needs, but only for medical expenses, including insurance premiums, co-pays, co-insurance, cost-sharing contributions, drugs, office visits, medical equipment, hospital admissions, procedures, physical therapies, and others. These funds would be transferable at will and without tax to the healthcare accounts of others. Accounts could receive non-taxed donations from others, and funds would be inherited without tax into the healthcare accounts of beneficiaries. Participants would be able to choose healthcare providers and insurance plans according to individual judgment and preference. Medicare tax liability could be reduced for these people either immediately or after a significant overall savings and reduction of healthcare expenditure liability for the federal government is realized. Second, after giving everyone this choice and requiring everyone to make this choice, we would release the market to respond to both groups, including providers, insurance companies, and the states themselves. We would release providers from any obligation to provide non-emergency care, and the cost of unreimbursed emergency care would be shared between providers and the government. Providers, not patients, would determine whether a presenting condition constitutes an emergency. We would expect providers to regulate themselves according to professional standards of care and ethics. However, they would also be obliged to abide by additional requirements and standards imposed by payers, Medicare, Medicaid, insurers, etc., if they choose to work with and accept reimbursement through those payers. We would encourage and facilitate publication of data regarding providers' treatment outcomes for reference by the general public and healthcare consumers. Real-time access to patient records, both medical and financial, would be also facilitated. Centralized medical records would improve quality of care but pose privacy risks. These would be optional to the patient and preferably maintained by private companies. The ability to immediately determine a patient's financial resources and arrangements is also necessary to minimize bad debt and cost shifting by providers. This could be accomplished electronically. What about the insurance companies? We would allow and promote nationwide competition amongst insurers, remove restrictions on the types of policies they can issue, encourage plain language, good faith summaries of coverage, and strictly enforce contractual obligations with customers. The states themselves would be released in many ways. We would encourage them to examine and revise professional facility and manufacturer licensing to maintain quality, but also to encourage competition. Encourage tort reform to reduce defensive medicine and malpractice costs, and publish data on the medical care environments of individual states for comparison by providers, insurers, and patients. What kinds of benefits could we see from taking this approach?